My name is Alfredo. I'm in the PTA program.
I'm Sean, same thing.
My name is Minor.
My name is Miguel.
And I'm Megan, in the PTA program as well. And we're doing a project on spinal cord injuries. We have 3 objectives. The first one is to define what a spinal cord injury is, also identify the causes and symptoms of a spinal cord injury, as well as explain how the PT and the PTAs help with spinal cord injuries.
And do you guys know what a spinal cord injury is?
The spinal cord is the human body's lifeline. It is vital for all of the communication between the brain and the rest of the body. When a spinal cord injury occurs, that communication is threatened, which could result in full paralysis or partial paralysis. Let's take a closer look at the spinal cord injuries.
So there are 3 parts of the spinal cord where your injuries can occur. The cervical would be 1 to 7, 1, 2, 3, 4, 5, 6, 7. And then thoracic, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And then lumbar region, 1, 2, 3, 4, 5. So the cervical and thoracic count as the neck and the mid-upper back of the spine, resulting in increased tone and spasticity. If you don't know what spasticity is, it's a motor disorder characterized by tight and stiff muscles and involuntary caused by damaged nerve pathways in the brain or spinal cord. So for injuries occurring in the lumbar region, aka the lower spine, it results in decreased tone and flaccidity. Flaccidity is a neurological condition characterized by weak, limp, and soft muscles.
There are 2 types of spinal cord injuries. One is the incomplete injury, which the spinal cord is still able to send some messages to or from the brain to the site of the injury, and then people are still able to have some type of feeling, function, and muscle movement. And then the other type of injury is complete injury, which is there is no nerve communication below the injury. This means that people lose muscle control, feeling, or function.
There are 2 types of paralysis: paraplegia, which is the thoracic and lumbar injury. It affects all or part of the trunk, legs, and pelvic organs, but it doesn't affect the arms. And then there's the tetraplegia or the quadriplegia, which is the cervical and the high thoracic. And it's the hands, the trunks, the legs, and then the pelvic organs are affected too.
Some causes of spinal cord injuries include, and most commonly are, motor vehicle accidents, serious falls, but there's also sports injuries,
and nobody's blocking.
Industrial or workplace accidents, as well as conditions that could damage the spinal cord that include tumors or infection. Common symptoms of a spinal cord injury include loss of movement, loss or change in sensation. This includes changes in the ability to feel heat, cold, or touch.
Another symptom is loss of bowel or bladder control.
Another symptom is exaggerated reflex activities or spasms, changes in sexual function, sexual sensitivity, and fertility.
Another symptom would be pain or an intense stinging sensation caused by damage to the nerve fibers in the spinal cord,
As well as trouble breathing, swallowing, coughing, or clearing secretions from the lungs.
Management of a spinal cord injury is complex and lifelong, requiring a multidisciplinary approach, functional, goal-oriented, interdisciplinary, and making a program that fits every patient individually. Your PT will be right with you.
Thank you.
Hi Sean, how's it going?
Pretty good.
How are you feeling today?
Still same pain.
Still same pain? On a scale of 1 to 10, what's your pain level?
Currently I'd say it's around a 4.
Okay. Has it been any worse lately, or you kind of just hovering right around there?
So far it's been steady.
Okay. All right, you feel up for some exercises today?
Sure, why not?
Okay, we're just gonna work on some range of motion, as well as just a little bit of strengthening. Does that sound good?
Sounds good.
Okay.
Hello, Sean. So today we're gonna start off with some shoulder flexions. Do you know how that looks?
No.
So just gonna read right there, just one, and that's how it looks. Just do 5 of those, please.
Okay.
Nice.
So it's a bit too easy. Can I add a little weight?
Yeah, here. You can use these, and then you can do some shoulder presses. Right. Okay, nice job. Sean, now we're gonna do some external rotation exercises. This is how it's gonna look. Just go like this. There you go. Nice. Okay, I'll take this. Thank you. You did pretty good today.
Hello, Miguel. How are you doing today?
I'm doing all right.
I'm gonna be your PT today. Help you out with some exercises. How are you feeling? Any pain?
A little bit of pain.
That's good. We'll try to help you out with that. So we're gonna start off with some knee flexion, knee extension. Do you know what that is?
No.
All right, I'll help you out. Is it okay if I touch you?
Yeah, of course.
Okay, so we're gonna lift your knee a little bit. And then for extension, you're gonna wanna put it out. Is that okay?
Yeah, it's good.
Okay, and then for flexion, we're gonna wanna do this. Be doing it. You wanna do maybe 2 or 3 of those, see how you feel?
Yeah, sounds good.
Think you could do it on your own?
I'll try.
Okay, sounds good. I'll be here. All right, yeah, looks good. Let's put it down again. You put your other one down as well. All right.
So spinal cord injuries can affect multiple aspects of a person's life. One thing to mention definitely is the psychological aspect. Going through an injury that interrupts your life can really cause a lot of depression. It can also create a lot of economic hardship if you lose your job, medical bills, therapy bills. Yeah, it's tough.
Some other aspects that a person's life is could be self-care. They won't be able to shower, get from point A to B, like say from their bed to like the shower, and then mobility issues, activities of daily life. Mobility is an issue too because they got a spinal cord injury, such as activity of daily living. They could struggle with that.
In conclusion, a spinal cord injury disrupts communication between the brain and body, often leading to partial or complete paralysis. Spinal cord injuries can be classified as complete or incomplete, with varying levels of function and independence. Common causes include motor vehicle accidents, falls, sports injuries, and workplace incidents, with symptoms affecting movement, sensation, and bodily functions. Physical therapy plays a critical role in recovering by improving mobility, strength, and overall functional independence. Long-term individualized rehabilitation helps patients regain independence and adapt to life after injury.